During this session, you'll be able to firstly listen to a 30-minute overview from the guest speakers and then participate in a 30-minute questions and answers session. I'm pleased to be able to welcome the guest speakers tonight, who are Charlotte Mitchell, who is the Head of Commissioning for Children and Maternity Services, Jennifer O'Neill, the Pathway Lead for #Thrive, and Tom Berrows, the Engagement Lead from Kooth. So I'd like to just pass you over now, if I can please, to Charlotte, who will be starting off with her presentation for you.
Thanks, Tracy. Okay, so I'm Charlotte Mitchell. I'm the Head of Commissioning for Children and Maternity in Rochdale, and then my post sits across the CCG and the local authority. So in simple, I'm responsible for health and care commissioning and the services that we buy for children and young people in our borough. So I just thought it'd be helpful to share a little bit about what a commissioner does, because I know it's quite a confusing thing for some people. If I'm honest, I didn't actually know what commissioning properly was until I was a commissioner, so even I didn't know. So today I'm going to share with you some slides really about our services for children's mental health in Rochdale and what they look like. So what is a commissioner and what do we do? So I put a few avatars on there of me and of Rachel, my colleague, later on, just to share with you really that we don't really take ourselves seriously. We're approachable. You can always ask us questions about things. And we want to know what's going on really in the borough, so please do contact us if there are any issues or any positive things you want to feedback. But what we do take seriously are our services, and we're very proud of our services, and you know, we work really hard to make sure we've got the right services for children and young people in the borough. We'll go back up to slide 2, Tracy, please. Thank you. So what does a commissioner do? So basically, a commissioner has to understand what is it that the public need from our services. So we need to understand what they need. We need to understand what those services do. We need to understand the law and the government guidelines around what services should do. But we also need to listen to the users of those services. So for me and my staff, it's really important that we understand what children, young people and families tell us that they need, which is why sessions like this are really, really important. We also work with clinicians, that's doctors, nurses, other medical staff, other clinical staff, to find out what they think. We do a lot of listening, we do a lot of talking to people and find out what services we need to be purchasing. We then plan those services, so we design them with people. We sometimes co-design them with people, with children and families. And we need to understand what is it as a gold standard we need to deliver and what can we realistically achieve. And sometimes we kind of meet in the middle. We would always like to do gold standard, but sometimes our resources don't allow us to do that. And I've just put a quote on there. It says, without data, you're just another person with an opinion. Everything that we do and every decision that we make is backed up by evidence, but we're always learning. We're always looking at different data and different sources of information to try and improve our services as well. Next slide, please, Tracy. So we purchase those services, we do loads and loads of paperwork, we involve children and young people in assessing who should be the right person to deliver those services, and we follow lots of rules. We then write a plan of what we want delivering within those services and what we expect of them. And we tell the public what to expect as well, and we should be communicating what services we have far and wide across the borough of Rochdale. We then check those services, make sure that they're of a high quality, that they're safe for our children and young people, that they're doing what they said they would do, and that they're reaching the populations that we need them to reach. We then review and respond if we need to change services. We have lots and lots of meetings, and we look at lots and lots of data. So the next slide shares really just a ship. So for me, we're on a journey. We'll always be on a journey, and we're always having to respond to the needs of our population to make sure that we're fit for purpose. And we're sailing a ship at the minute through some quite tricky waters. There's lots of changes going on in the NHS, but what's really important to us is that we keep the outcomes for our children and people at the centre of every decision that we make. The next slide really, and the one after it, just shares a bit of a journey of the things we've done for children's mental health over the last 5 to 6 years really. So our transformation journey, which means our change journey, started in 2015-16, and there was a document shared by government called Future in Mind, and this set out lots of ambitions for children's mental health services, and I'm really proud to say that we have achieved a lot of those ambitions in the borough. We've got services like #Thrive, and Jen's here tonight to tell you about that, which is really different to what's going on in other areas, and we are, I think we're ahead of the game with regards to the services that we have, but also in the way in which we work with our voluntary sector. We know that children access support where they want to, where it feels comfortable for them, and it's not always that medical model. So we do invest a significant amount of our resource in our voluntary sector, and we'd like to maintain that as much as we can moving forward, because we know that there's lots of ways in helping a child who has emotional mental health needs, but it's also really important to prevent that from escalating. Next slide, please. I'm not going to go in detail with these slides, but they do give you just a snapshot of the things that we've done year on year, and something that we're proud of in this last year is that we were successful with a bid during COVID for our mental health support teams in schools, and they're going to be in 38 schools. We work with the local authority closely, and we want to expand this offer across the borough so that we've got training for teachers, that teachers know how to support children and young people. And this will complement our fantastic Thrive service. Next slide, please. So we look at data, I said that earlier, and how do we know that we are doing well with regards to children's mental health? There's lots of things we can measure, but I think one of the things that stands out for us, we had a target in 2017 that by this year we would work with 35% of children with diagnosable mental health services. And the information in the green below and in the red shows Greater Manchester and what everyone else is achieving across Greater Manchester. Now we're targeted at 35%, we're actually reaching over 63% of children and young people. That's almost double our expectation, and you can see from other areas that we're doing far better than other areas are. So I'm really proud of my team and my services for achieving that. I think we've gone a long way, and we've got a lot of improvement that we are going to make moving forward as well, and the mental health support teams should hopefully help us with that a great deal. Next slide, please. So what are our priorities for the next year, the next couple of years? Despite the way in which our services are delivered, we will make sure that children get care at the right time and in the right place through a Thrive model, and I'll talk a little bit more about Thrive models in a minute. We've got our mental health support teams in schools. We're making sure that we're redesigning our voluntary sector offer so it wraps around the Thrive offer, so that people can go to one point of access and get a signpost into the right direction to get that support. We want to build resilience in schools, in children, young people and families, which means giving them the skills and the resources to self-manage. We want to improve the journey for children who are in crisis, because unfortunately some children do get to a point where they may present at A&E, or they may be self-harming, or sometimes unfortunately they end up in hospital, which is what we need to avoid, because that's no good for anybody. We want to increase our support for our cared for children. We also know that we've got lots of children with learning difficulties and autism that need that extra support, and we're looking at new services to support those families. We're also redesigning community eating disorders. We know that we've had real increases in eating disorders during COVID. It's something we need to address. Youth Watch is led by Health Watch, and we've been working with Health Watch really because we want Health Watch to be able to reach for us, because we can't always do it, we don't have the time to reach the voice of as many children and young people as possible, to feed into designing our services, because that's really, really important to us. Next slide, please. So we want support in the right place at the right time. We want the right resource at the right time. It has to be meaningful to the child. We want our professionals to know our children, and we want those professionals to have the right skills to support the children that they're working with. So Thrive there, that's the Thrive model, the circle in the corner, and that just demonstrates that it's about getting help, getting advice, getting risk support and getting more help, and that will, services will be slotted into each of those areas, and children will flow in and out of those types of support. And in the words of Dr. Seuss, unless someone like you cares a whole awful lot, nothing is going to get better. No, it is not. And you know, that is our philosophy, that everybody should be caring for our children, and children should be at the centre of everything that we do. We know that children who have mental health disorders in children, they're often established by the age of 14, and we know that 75% of mental health disorders are established by the age of by 75% by the age of 24. So we need to reach children early, and we need to prepare, and we need to build strong children rather than having to fix poorly adults, and that is what we're aiming to do. Next slide, please. So we've got a lot of ambition. We've got a really strong vision for children's mental health services in the borough. We're really proud of what we've done, and we're really proud of our vision for where we want to go with that. But the success really is around us working with other organisations, gaining ideas from events like today, or feedback after this, if you're watching this video. It's about keeping positive, and it's about us leading it. I am clear that I want to lead this agenda with others, not just me. It's around that distributed model where everyone is leading this agenda and they're placing it at the heart of everything that they do. We know it's going to be a challenge, but we're very hopeful about the future. Thank you. Questions?
I think it's okay, Charlotte. We'll do the next presentation and come on to questions at the end. Thank you very much. So over to Jen O'Neill now, please. Thank you, Jen. Thank you, Charlotte.
Thanks, Tracy. Okay, so I'm Jen O'Neill. I'm the service lead at #Thrive. And #Thrive is a emotional health and wellbeing service for young people in the Heywood, Middleton and Rochdale areas, for young people 0 to 19. We're based on Darn Hill. We've just recently moved there following our building that was on Drake Street that some young people and families may know not actually being fit for purpose anymore, and we've certainly outgrown it. The #Thrive service is part of the Healthy Young Minds mental health services. So we all work together to make sure that we're the right people for you, really. So how do you access Thrive? So a young person can be referred to the service by a professional supporting them. So that might be your school, it might be your school nurse, your GP, and that referral goes to our single point of access. That single point of access will then read the information that's been sent, and if they think that we're the right service for you, then they will send us your information and we will then get in touch. Or you can actually contact the service yourself, either yourself if you're over 13, or you can ask a parent to contact us. So what happens at the first appointment? Okay, so the first appointment is often called a drop-in. That's just the way that we call it, because once we're not in COVID, the idea again will be that you can actually just rack up between certain times. So it used to be on a Tuesday evening, Thursday evening and a Saturday during the day. And we will, once COVID's over, go back to that type of a model. We're just doing it as a booked appointment at the moment because we need to make sure we've got the right number of people in the building to keep everybody safe. Okay, so at this first appointment, what happens is you'll be met by a member of the staff, and they will talk to the young person about what they feel they need help with. Okay, so it's very much about you as a young person and what you feel that you need support with. And they might ask your parent or your carer also what they feel you need support with too. Okay, and with that member of staff, you will then talk through what those difficulties are, and they'll think about what support will be the most appropriate for you. So whether that is something from ourselves or whether that is something from another service. Okay, Sometimes Thrive is absolutely the right service for you, and you'll be placed on the waiting list for that. Sometimes, though, you might need more specialist support, and at these times we would pass your information with your consent up to Healthy Young Minds, also known as CAMS, and I think we use those two sets of terms interchangeably. Okay, and the reason that we would do that is because they are more specialist practitioners and they can do more specialist assessments than we can do. What we don't want to happen is for us to say, actually, we're not the right service and you need to go to these people. We'll do that work for you. So we'll meet once a week and we'll look at young people who need to be stepped up to Healthy Young Minds, and we will do that process. Likewise, if you've been seen up at Healthy Young Minds and they think that maybe counselling is helpful for you, they will step you down to us. So it should be a much easier service to access, and we can do the same in terms of stepping into the mental health support teams. The early attachment service are based with us, so we should be seeing a much more seamless service for people. Okay, but we also find that sometimes you might need a different service. So we've got Tom joining us tonight from Kooth. So we might suggest an online intervention for you, or lots and lots of other different voluntary organisations that we can signpost young people and families to, or indeed school and social care, etc. Okay, next slide. So what sort of things do we support with? Okay, so we support young people with lots and lots of needs. So it might be about worry, low mood, people feeling really fed up, not quite knowing why they're feeling fed up. Might be a bit anxious, might be a little bit worried about going to school, worried about, particularly at the moment, I guess, COVID and what that might mean. You might feel that you're not very confident and you want opportunity for someone to help you to be able to put your hand up and ask those questions in school. We can help with lots and lots of those things. We've got lots of different staff within the service who offer different ways of working with young people. So we've got what we call facilitated self-help. So that's like a manualised programme where you will come up with some of the solutions yourselves and think about, if you're getting angry, what are the things that make you angry, and what are the things that can stop making you sort of maybe hit out or sort of throw things around, things like that. We've got counselling, but we also have, which I think we're really, really lucky in Rochdale to have, we've got what's called social prescribing, and our Link for Life practitioners will look at leisure and social activities. What we know is if people are busy and kept active, that things like low mood, worry, anxiety are often lessened. So we look at a whole programme of interventions that will help young people. So if we think about exams, for example, that's one time when we think, actually, we need a real balance of work, rest and play. And so we can offer some of that exam management, worry management type of intervention alongside our Link for Life staff, who can really help with trying to get you out there, get you busy, keep, might be football, might be swimming, anything that you're really interested in, they can look to signpost you to. And we have a lot of groups that we also run ourselves. What we can't help with, and I think this might be one of the things that people think that they can come to us for, but we can't, because we're not the right service for it. So we aren't a service that can diagnose young people. So we sometimes hear of people using the term ADHD or autism, for example. We're not a service that can offer those diagnoses to young people. They are specialist assessments that need to be undertaken, if appropriate, by Healthy Young Minds. We're also not a service that deals with self-harm or suicidal thoughts. They again require more specialist intervention from Healthy Young Minds services. So if people have got those thoughts and worries, the best place to go initially is to the single point of access, and they can signpost you up to Healthy Young Minds and you can get the support at the right time. Okay, they've also got links in with Rapid Response Team, so we can get somebody out to you as quickly as possible and make sure that people and young people are safe. And so where can you be seen? So our first appointments at the moment are at the Thrive building on Darnhill, or we can also offer telephone appointments where travel is difficult, or if young people are self-isolating or family members are isolating. And the reason that we are currently only offering face-to-face appointments generally at the Thrive building is purely because lots of other buildings aren't open to us. If that is a real problem and you do want to be seen elsewhere, if when you speak to somebody on the phone, you explain that, we will come and see people where they need to be seen. So if you need to be seen in school, we can see you in school. If we need to do a home visit, we will do a home visit. It just might take us a little bit longer to negotiate our diaries and stuff to fit that in, but we will see people where they need. And then when you think about moving forward and having further appointments, we will offer them where possible, wherever we can. Okay, so if you want your counselling sessions in school, then that's what we can look at as long as your school will let us in. So yeah, so we're happy to see people wherever they need. If people don't speak English as a first language, we will look at using interpreters. Again, we just need to know that so that we can arrange to have an interpreter present. Okay, so you access the service just if you're a family member or a young person yourselves. If you phone the team on that telephone number, we will arrange your first appointment for you. We have to see young people and families for that first appointment within 10 days, and we absolutely can meet that 10-day turnaround at this moment in time. That's not an issue. Or again, you can ask a professional who's working with you to refer you to our single point of access, and the details are there as well. Thank you.
That's brilliant. Thank you very much, Jen. I'll just stop sharing your PowerPoint and then we'll go over to Tom, if we can, from Kooth, please, for our final presentation.
Yeah. Okay. Hopefully that's worked and you can now see my screen. So yeah, I'm Tom and I'm with you from Kooth. Now, just so that you kind of got like a little bit of information before I give you all of it, we are a free online service which offers emotional and mental health support for children and young people. Now, one of the key differences with us than a lot of services is that there's no referral needed. There's no real process behind it. It is just a website that young people can come to themselves and just do the very, very simple sign up process to get onto. As I say, it's free. And one of the first things I always say to people when I'm talking about Kooth, whether it's young people or adults, is that if young people come to the platform and they give it a go, either for the peer-to-peer stuff or through to get our sort of professionals help, and they don't like it and it doesn't work for them for a variety of different reasons that could be, then they've lost absolutely nothing in that process because it's so easy to sign up and it's completely free. It's really safe to use. And I'm going to show you at the end about our sort of safeguarding procedures that are involved. And it's an entirely anonymous service. So they're not only anonymous to other Kooth users on there, but they're also anonymous to us as well. So the sign up process really is as simple as this. They'll come onto Kooth.com. It's not an app, it's Kooth.com. And they'll go to sign up. And then they're just putting in this really, really simple information. So it's the area I live, so Rochdale, and then the place, let's narrow it down a little bit further, and then the year and month. So you'll notice with this, we're not taking an address and we're not taking a date of birth. So none of this could be used to identify these young people. What we do need to know, though, is that they're in an area that's covered by Kooth, which they are in Rochdale, and that they are within an age range as well that is covered by Kooth. So that, you know, yeah, as I say, all it'll always have like set age ranges, so we just need to know that they are within that age range. The gender and ethnicity, then it is just those options, whatever they feel most comfortable with and whatever best represents them. The username and password, then, so it's really simple. Again, it's just like setting up an account with anything else. So just popping in their details, popping in what they would like to set it up. So with their username, they can have a bit of fun with it and make it kind of something silly or whatever they want to do. But we just ask that they make it completely unique and not something maybe they've used as like a gamer tag for Xbox or PlayStation, or something they've used for social media, because that could be used to identify them. And then with their password, we just ask that they make it really memorable and or write it down somewhere safe, because we don't have one of those forgot your password options, which if you're kind of forgetful like me, you'll probably rely on all the time, because of course that has to go through like a separate email address or something. And then we'd have that information that could be used to identify them, which we don't want. Now, our online counselling service is one of the major parts of Kooth, about what we offer to young people. And this is available 365 days a year between set times. So, you know, we have young people using it on Christmas Day and all sorts. It's one of the things we're really, really proud of, that they can literally just come on. As I say, they don't need a referral or anything like that. They can just come straight on and they can press request to chat, and they can talk to one of our fully licensed, trained professional online counsellors, you know, just by simply requesting a chat, and they can get that advice, that support, somebody to listen, and they can help them with that as well. Now, not only do we have kind of like counselling and things like that, we do have peer-to-peer support and other ways in which they can access support through the Kooth platform. So the magazine is one place that you'll see this. So this is everything from kind of personal stories, a lot of kind of poems, lots of kind of different content on here. It's not all about mental health and well-being and how they're dealing with situations. A lot of it is just kind of just discussing, you know, films that mean stuff to them, or, you know, music that they've been listening to, and all sorts of different stuff. Now, there will be some stuff on there as well that you'll see kind of like real names. So where we've put up stuff that we think is relevant, that's interesting or otherwise. So it's not just young people, but the important thing to know is that everything on our platform is entirely pre-moderated. So what this means is that before something goes live, so if somebody tries to post a comment, or if somebody tries to post their own article or poem or whatever, it will get checked by a member of our team before it goes live on the site. So you won't see anything on there that's kind of like trolling, bullying, that's harmful, or anything like that. So really, really important that that we know that, because it keeps it all kind of very safe and secure. So everything gets checked. It's not like social media. You just pop something up and there we go. It's live. It's done. It's a very, very different sort of format. With Kooth forums, it's the same list of sort of categories that you'll see in the magazine. So everything from the kind of like what people are, you know, what, I don't know, board games people are playing, or what sort of like about sports, about kind of film, TV, music, to the more serious things where somebody will say, you know, I'm having this particular difficulty with my friends and family, my friends or my family, or something like this, and this is my scenario. And then you'll see lots of comments come through from other young people looking to help and sort of support and things. So the difference is the format, the forums. It's much shorter, and it's just people coming in and saying, you know, this is my situation. Can anyone give me any advice? And it's much more about those comments that come in from other young people saying, yeah, I've been there, I had that exact same scenario, and this is what I did, or this is what you could do, or maybe just like you need to believe in yourself, or, you know, that kind of thing. So just lifting each other up, that peer-to-peer side of things. The Kooth activities, it says there's 18 here. There's actually 22 of these. We updated this recently. So these are self-help things that they can do in their own time. So they're like step-by-step instructions on these. Whether that's about practicing being present, or whether that's about them creating a good mood playlist, or improving their bedtime routine, or practicing asking for help. You know, lots of kind of different things that they can explore on here. They're really worth sort of checking out and giving a go in their own time. As with all parts of the platform, some of it they'll find useful and they'll like, and some of it they might not. Some people come on and use just like a small part of it, maybe just the online counselling. Some people want to use all of it, and that is totally up to them. We just we encourage all young people just to kind of check out everything and see which bits they find useful. Now onto like the counselling and the safeguarding and how all of that works. So as I said before, we don't have any kind of like volunteers. They're all professional trained online counsellors. So everything they do is completely through evidence informed practice, and they're constantly sort of keeping up with the best way in, of working with young people and working with certain situations. And a huge part of that is just building up evidence when working with our young people. So one thing they'll do is they'll use lots of resources like this. So this is one example of where they've the counsellor may have identified that this cognitive behavioural therapy worksheet could be really useful for this person's sort of thoughts and actions. Now, what they'll do with this, for example, is they would inbox that to the young person for either them to do during that session with them or to do ahead of the next session. So they could do it like separately and bring it along, and they could discuss that between them. But this is just one example of something that they might use where this was relevant. And they've got loads and loads of more different stuff like this. It's also important to note that sometimes young people will come to us and they'll say, do you know what, actually, I'm not here about me so much. I'm generally kind of okay. I'm actually just a bit worried about my dad, my brother, a sibling, a friend, and I've just noticed these kind of signs in them, and I wondered whether we could talk about that. And that's absolutely fine as well. So our emotional wellbeing practitioners then would likely talk to them, and they would say, so, between, so it sounds like this is what, this is what's happening. And this must be quite difficult for you. So they'll offer that support for how they support themselves and also how they support that person. So it doesn't have to be about them specifically. We do send out this core young person assessment tool. So it's like bit in the yellow here before every chat. So when they request a chat, they'll be asked to do one of these. And based off of the responses they give to this questionnaire, they'll be given a score and then a red, amber, green rating. Now, based off of that, they will be assigned a place in the chat queue by the chat queue manager. So this isn't to say that, the yellows and the greens aren't ever going to get seen. It might just be that, if it's a particularly busy night, that the greens are like asked to come back in an hour, or to come back at the same time tomorrow, for example. It's just obviously that we do need to prioritize those red risk young people whose, responses are quite worrying to us. You'll also see that journal. So it says journal there. So this is what the online team can see. So we can see all of the young people's journals, and we will regularly go through these just to see if anyone's written anything in them that's concerning, and we need to offer them a chat to support them with that. And the counsellors will look ahead of the chat that they go into just to see if there's anything in that journal that they've put that they haven't brought up in that chat that could be useful to talk about. They are aware that we can see that the journals, that we're not just like randomly snooping on them, and they are very much aware that, yeah, we see those. Sorry, I don't know whether you can hear that ice cream van outside, it's a bit annoying. So we also do set SMART goals. So the counsellors will, so the example that you can see there, and this is where they've obviously identified with them. So you're having issues with your anger, but you've identified that listening to a certain piece of music or certain music can really help you. So what I want you to do is make a conscious effort this week to use music to help you when you are in those angry situations, and then they can kind of move their score depending on how they've got on with that. And then they can chat about, where they are with those scores next time they have that chat. We build extensive case notes. All counsellors will, of course, always do this when they're working with people over a period of time. And this helps us to know kind of where they're up to, everything about what the chat involved, about presenting issues. And so that when they continue in doing this chat, they've got that to hand then before the chat. It also helps just in case, obviously, if it is a different counsellor who they're talking to, then they've already got all of this information to hand before they go into that chat. So it's really important that we do build up this extensive case notes. And it also means that if we do have to signpost over to another organisation, that we've then got this information to hand ready to go. Now, in terms of signposting, it will be sometimes, in rare cases, that we are really quite concerned about these young people and what they're telling us, and we're experts in realizing when we can't help in the immediate situation. So if that is the case and we're really quite worried, then this is what we'll say to them, is that we're really quite concerned about you and what we're saying, and we just want to keep you safe. So would you mind identifying, kind of giving us some information that we can identify you with so that we can get you some help? Now, be that from the police, be that whoever that is, then obviously we don't have that information. So we have to ask young people for that information. It's up to them whether or not they give that to us to be able to help them. We do also signpost as well without kind of taking, so sometimes it will just be the case that we'll say, actually, do you know about this other service that sounds like they could really, really help you, without actually needing to state their details. We're just telling them about the service. Now they've all got, after a session, they'll all get sent an end of session feedback questionnaire that looks a little bit like this. And this is helpful for a couple of things. It helps us to know that our service is useful and it's productive and it's relevant to young people, but it also helps us to know, was that counsellor specifically a good fit for them? And if not, then we need to maybe look at getting them someone else. And if it was, then maybe we need to make sure that it's that same counsellor who they're with next week, and they need to work out times to do that. I'm not going to just read at you our safeguarding statement, because I don't think anyone needs that. But, you know, feel free to kind of, if you want to find it, it's quite easy to find, or I'm more than happy to send it to anyone. But all I want you to know from this really is that it is of the utmost importance to us, our safeguarding, and we put huge amounts of work and energy into making sure that, you know, our procedures are robust, and they're carried out to the fullest, and are constantly sort of updated and checked. So yeah, safeguarding is the core of everything we do. Keeping people safe is everything to us, whichever way that takes. And that's it really from us at Kooth. I think tried to cover more or less everything that I could in the time.
That's brilliant. Thank you very much, Tom. And thank you also to Jen and Charlotte for your presentations. And hopefully people will be able to pick this up on video as well and spread that message wider. And if anybody wants contact details to get in touch with yourself, obviously they can either search your names on the internet or your organisations, or contact Healthwatch Rochdale directly, and we will signpost them over to yourselves. Thank you very much. We'll stop recording now.